And then I got him on the table and I'm looking, I'm like, no, it's your hip. I was like, you didn't even need a back surgery. It is from your hip. And so he went back, and then the orthopedic said, you're right, it's from the hip.
And what's up everybody, CW here from Consider It Health, where I consider some of the big topics in health today. And recently I had the opportunity to sit down with Mike Chon, a physical therapist located in Los Angeles, California, who I met about 4 or 5 years ago on a medical mission trip to Honduras. And what amazed me about Mike was the results he was getting with the patients there in terms of increasing their mobility and decreasing their pain. And so what I found out later was that he had gotten a lot of additional training and different techniques he learned beyond what he gets in PT school. And he also has a very holistic approach to the body, in which I definitely appreciated. Now, recently in our interview, we talked about a bunch of different topics, but one thing we kept coming back to was the spine, specifically low back pain, sciatica, scoliosis. So these are big topics, and so I thought I would share with you guys an excerpt from our interview. Welcome, Mike, to Consider It Health. You're my first interview, so I am excited about this, and we will just jump in. And so, Mike, you work as a PT. You've been doing working as a PT for how long now?
It's been 18 years, CW, yeah.
Wow. Okay. All right. Nice. One thing that a lot of people come in with, of course, you know, they have their knee issues, shoulder issues, but I think back pain seems to be a really hard one. And I mean, our therapies are basically, a lot of times we send people to physical therapy, of course, and then they end up needing, you know, epidurals, and they end up, sometimes they'll need surgery and different things. But it seems like back pain is a tough one to treat, especially if there's like sciatica involved. What's your experience with that back pain? And then if you want to add sciatica as well, and then how do you get people better from that?
Yeah, back pain, you know, it's pretty common. Almost everyone's going to have back pain at some point in their life. You know, it really depends on the severity of the injury, you know, how much damage they've already caused in the back. And so number one is prevention is the number one thing. And so a lot of people, what happens is the course of back pain is this: unless you've had something, you know, like a serious injury, what most people experience is they have pain, you know, maybe first time they've ever had back pain, lasts a few days. You know, it's achy, it's sore, maybe hard to move around for a few days, and starts to get better, you know, maybe in about a week. And then they just move on with their life. Then several months later, they get the pain again, and then they last a little longer. It's a little more painful, but then eventually gets better. And so the point is that the back pain will come and go for a lot of people. And the problem is that people ignore that pain when it happens, and they never take care of it as the progression goes on. What's happening is that the back is actually getting worse. It's actually changing. Anatomically, it's changing over the years. And every time you have these episodes of pain, something is wrong. Okay, you should not have pain in your back, in the normal back, and so in the healthy back. And so that's when you need to start doing some things for your back to prevent it from that progression of having multiple episodes of back pain. The more episodes you have, one day you will have back pain, and that back pain will not go away. And that's where most of the time the people come see me is at that point. And I usually tell them, if you came to me about 5-10 years ago, we could have solved this and have no problems. But if you come to a point where the back has changed in terms of its actual anatomy and the structure of the spine, with the degeneration or herniation of the disc, and if it's severe enough, there is really not as much we can do at that point because the anatomy has changed. But if it's still in a moderate stage, we can do a lot. We can do a lot to change their pain and to prevent it from coming back, and really keep their back healthy for the rest of their life, as long as they maintain some of the things that we tell them to do. But even if it's severe, there are certain things, depending on if there isn't too much of a change in their anatomy, even moderate kind of changes, we can do a lot to help them and to get better. And so you definitely want to go see somebody that knows what they're doing regarding the back pain. But it is difficult once you've had a degenerative spine that's completely kind of collapsed on each other, and we see that especially as you get into your 50s, 60s, 70-year-olds, depending on what they've done to their spine. You've changed from a flexible spine to a very rigid spine. And now you're worried more about, but the rigidity that's in the spine is in a sense kind of like an unstable rigidity, okay, where that spine basically can collapse and become very problematic for the patient over time. And so when a neurosurgeon goes inside their spine and they look at the disc that's in between the vertebrae, and if it's very if the degeneration has proceeded, they just have to tap on that and it'll just crumble out. It'll just kind of crumble out into little pieces. So that's kind of what some of our elderly folks are working with. They're working with a spine that's on these little discs that have basically been dried out and ready to crumble. And so for them, we need to, even though they're rigid, we need to keep them rigid in the sense. We have to keep that stability in their spine. For the middle-aged person that's maybe having some issues with back pain, this is really where you have to look at different structures around the spine to make sure that you're not adding extra stress to your spine, and then making sure that the stability of the spine stays the way it should so that the degeneration process is stopped, okay, or at least slowed down as they age. So I don't know if that answers your question, but yeah, that's definitely a big problem with people ignoring their pain and not getting the right help at the right time. I think is critical for anyone that has back pain.
So what are some of the common maybe mistakes, or is it certain lifting techniques or ergonomics or things that people do that continue aggravating it? And then if so, then what at that point could they do? Is it just merely correcting those erroneous posture techniques or the ergonomics? Or is it just strengthening their core? Like, what are some of the things that you would recommend?
Yeah, I think the main thing is as you look at each person, the biggest, if we can just kind of generalize some of the people that we normally see are people that sit a long time. And so you have people that are sitting, which puts the most pressure through the spine. Any position that we're going to be in, sitting is the worst. Sitting slouched is the worst. Even sitting with a good posture is worse than standing. And so what you want to do is for those that are office workers and those that are sitting all day long, you need to really kind of get up and move around. Probably every hour and a half, you need to get up and move around a little bit. And on top of that, because of our sitting posture, our front of our hips get very tight because our knees and our hips are always bent. And so that part gets always tight. And those muscles, the iliopsoas muscles actually that are in the front of our hips, are the only muscles that are really directly attached outside of our spine to the spine itself, in the front of our spine. And so when those get tight, those pull on the spine as well. Okay, so every time you stand up, those muscles, if they're tight, are going to be put on stretch, and then they're going to be putting extra stress on the spine. And so we got to make sure we stretch out what we generally term hip flexors. Okay, you've probably heard that, just hip flexors in general, and learn to stretch those out. The other part is the hamstrings, which has always been talked about for decades. You can definitely stretch those out as well. That comes into play if you're bending. If those are tight and you're bending over multiple times for whatever reason, maybe you're a gardener or something like that, where you're picking things off the floor multiple times in a day. And if your hamstrings are tight, then it can put extra stress to your spine because you won't get that movement through your hips, but instead you would have to bend your spine to get that movement. The biggest movement that's a danger is people lifting something heavy and twisting. Okay, that's the no-no that I tell everyone. Don't lift anything heavy and just twist. Move your feet with your body. Just making sure so that you're not causing that kind of torquing stress through the spine. That's probably a big one that people don't realize that they're doing when they're lifting things and kind of putting them on another shelf or something like that where they twist their body. So a lot of it is going to be checking out what's happening with the person. So the hip flexors, hamstrings are definitely important for the spine. And then hip muscles are very important. Okay, these are muscles that usually most people don't work on unless you're just like a gym rat and they do all these like hip exercises and try to get the big, I call it the big house. Okay, you got to work on the big house. Okay, the butt muscles. Okay, and you got to really work on those and the hip muscles, which in a sense is your foundation for your spine. And so if the hips are weak, your spine will take the stress as well. So if your hips are strong and your butt muscles on the outside and on your butt are strong, that will help stabilize your spine. The spine will move along with whatever the hip's doing, okay, and the lower half is doing. It's kind of like the foundation. And then, of course, all the core exercises that people, they went crazy with the core exercises about a decade ago or so, 20 years now. Those are all definitely helpful as well. But if anything, if you're going to focus on anything, it would be, stretching those couple of muscles, the hip flexors, hamstrings, working a lot on your hip muscles, and then just, making sure you're not sitting, all day long, so getting up and moving around a little bit. And that should help most of it. Most of the problems that we face are from those issues.
I've heard oftentimes, again, is that the hip and the back is so correlated. Sometimes they refer pain to each other, and the back issue may be actually because of a hip tightness, or like you said. Oh, there you go.
Yeah, CW, I'll tell you a story about somebody I saw. He actually went in for spine surgery, and
Okay.
then I saw him after the spine, so I didn't see him before the spine surgery. And then I got him on the table, and I'm looking, I'm like, no, it's your hip. I was like, you didn't even need a back surgery. It is from your hip. And so he went back, and then the orthopedic said, you're right, it's from the hip. And so he had to go get a hip surgery. So this is very important to make sure that the hip and the spine, we make sure we know what the problem is and where it's coming from before we do any surgeries.
Wow. Now that's too bad. Yeah. Would you say, if I can just take that a step further, I know in PA school we're taught look at the joint above and below the level of pain. Is that true? So like, can someone have a knee pain, but it's again also due to their hip, or their hip pains due to their knee? Like, does that work that way as well commonly?
Yeah, absolutely. Yeah, you just work up the chain, and so what we say, yeah, and that's a good start to look above and below. So, for instance, any knee pain I have, I look at their hips and I look at their ankles and feet, and usually I can treat their hip or ankle problems, and their knee pain will go away. And so you don't want to always just focus on the one joint, but you want to look at the above. You may even look 2 or 3 joints up the chain as well, and see if something else is contributing to the way that they move or the way that the problem that they're facing. And so that's definitely absolutely true.
Yeah, so it's even like I've had people with leg length discrepancies where one leg is maybe half an inch shorter, and sometimes you wonder, oh wow, that's maybe causing their neck pain or giving them migraines or things like that too, if it's not corrected, right? So it's all holistic that way.
Oh, absolutely. Yeah, absolutely. And that's a big problem. And then there's a problem in the upper neck, C1, C2, that actually can contribute to most people that have scoliosis. And this is where, as kids, if and this no one examines kids this way. Okay, and this is the problem when you have young kids start to develop scoliosis, and then they tell you to just like hang on a bar or something like that. I don't know what they treatments anymore. I don't work with pediatrics, but if I can get in with kids that have scoliosis, the number one problem that I believe they have is a C1, C2 deviation. So what that C1, C2 deviation will cause is going to cause a head tilt. So if you have a head tilt, but you're not going to walk around with the head tilt, so you're going to move your whole body to get that head straightened out. You're going to curve your whole spine to keep your head vertical during the whole time. And so if we can assess C1 and C2 on kids, I think we can probably solve a lot of these kids having scoliosis down the road. But that's something that's never even talked about that I know of at least from pediatrics. I don't know if that's in there, but that's something that I always look at if someone comes in with scoliosis. But a lot of times, by the time they come see me, they've it's progressed so far, or they've already put in those rods into the thoracic spine, and it's already done. And so then we still correct what we find, but I don't want to tell them that this is something that could have been resolved when they were like 7, 8 years old.
Right.
So, yeah.
Right. It's postural adjustment. They're adapting to like a compensation essentially is what you think over time. Okay.
Yeah. And you'll see that maybe you might be able to catch it maybe in your office if you see people that have like a asymmetry in their face, like one eye is a little higher or below than the other, or their nose may deviate to one side, or their smile might be a little bit crooked. Then that's a big sign that they have a C1, C2 deviation going on that they've had their whole life. And so you may see that as well. So you look at their faces and you might see it, and then they'll have TMJ, dysfunction, headaches, migraines, and that could be all contributed to C1, C2. Yeah.
And that can be corrected, you're saying, C1, C2?
It can be corrected, yeah, absolutely. Okay. Yeah, absolutely corrected, yeah.
And is it just adjustments?
yeah, it's correcting the alignment of the C1, C2 for sure. And then if they're having TMJ dysfunction or they've had some of those things going on for a while, then we need to correct actually their jaw movements, if they've already created some damage in there. But there's other things to correct, but you have to correct C1, C2 if you're going to correct anything else after that. If that's not corrected, you're just perpetuating the problem over and over again. And so you'll never get the results you want to get, whatever way, if you never correct C1, C2. It's a huge problem, C1, C2, yeah. So that's why if you look at chiropractic care, they have a whole area just dealing with C1, C2. They've created, the new chiropractors you know, specializing only in C1, C2, because they've actually figured out that that's an important area. But most people, you know, think they're crazy, but
Yeah.
but I think they're actually the ones that are very good. Those chiropractors are very good, actually.
Okay.
I think they found something that I believe is a big problem with posture and things like that, and headaches and migraines and so forth. So it's a
Wow.
big problem. Yeah.
That's fascinating. That's
Yeah.
cool. If I can go back to finish up the thing about the sciatica, like I know sciatica, some patients even say they have chronic sciatica, which, you know, if it's a pinched nerve root, I could see how that would do that. But have you had much success treating that? Because it seems like some people it lasts for 1 to 2 weeks, but some people last for months, and it's just agonizing for a lot of those people.
Yeah. If they don't have a positive, let's say an MRI where they show that the disc is actually herniated and then it's actually having a nerve root. Let's say they don't have a nerve root impingement on imaging, and they still come with you with sciatic pain. So the issue is it's not coming from the spine, but it's coming somewhere else as the nerves are exiting the spine and going down their leg. Many times it could be caused by a fascia or muscle as it enters and exits through different structures in the leg. And so you'll need to kind of assess that and go follow through the nerve track and see if there's anywhere that the nerve is being restricted and is being pulled on, or is not allowing the nerve to glide properly. And there's ways to treat that. We can treat through the tissues, and we can treat through what we call nerve gliding, and try to see if we can kind of get that nerve to make sure it's loose, kind of goes through the tract and there's nothing impinging on the nerve itself. And so that's something that we would look into and see, and a lot of times that could be the problem. If there's some type of neuropathy or something like that, you'll need to kind of look into that as well. If they're having some type of symptoms that they might say is sciatica, but it's really, you know, when we term maybe a kind of like a neuropathy going on. You know, for the most part, if they're having nerve sciatic type symptoms and you do not have any imaging that shows a nerve root compression, we can pretty much solve those problems by doing some of the things that that I just talked about, and it should be resolved. You know, there's probably a rare case where something is wrong just with the nerve itself, and that might be something that we may need to look into more further and find out if there's been damage done for some reason to the nerve itself.
I think those are actually all the questions I have for today. So thanks for your time. I appreciate you carving out time to do this and help other people as well. So
yeah, thanks, CW. Yeah, I appreciate it a lot. You know, it's a great time talking to you. You know, there's definitely a lot more we can talk about, but you know, hopefully this has been a good talk and good for your audience as well to learn a little bit. And of course, any more questions, we'll be happy to answer those for you as well.